by taking out the guesswork. I know from the provider side, you have a few different, layouts of how things work, right? So not two clinics are going to be the same, where one clinic may have someone, on staff who breathes and sleeps, HAE, so they know all the ins and outs. You may have a different office who maybe isn't as knowledgeable. They may have hired a new coordinator who doesn't know the different pieces and even know how, Cyclovita can assist with bridging the gap. So one, it's understanding the provider's needs and trying to not take over what they do, but to truly be a support system for them by essentially spelling everything out for them or giving them the recipe based off of the knowledge that we have. In terms of working with the actual payers themselves, it's in doing our due diligence and getting all of the necessary information that may be needed in order to gain approval. Sometimes it's, hey, what's the time frame look like for this, right? Because the goal is not just to get a patient on approved for therapy, but it's to do it in the quickest manner possible, because this isn't something that, a patient can just wait on. These it's a serious condition that is being dealt with. So we act as the middleman in a sense of, when it comes to the payers, getting all the necessary information that may be needed. It can be following up with the payer to make sure that they've received, a privatization request, or if they've said, hey, we've received the request, but additional documentation is needed from the provider. And maybe bridging that call. Maybe they didn't receive the facts from the payer indicating they're needing those additional documents. So making sure that everything is aligned, making sure that the communication that needs to happen between both of those take place. And then essentially, if we're going back to the providers, helping them overcome any sort of barriers that may come based off of what, the insurance or payer is saying.
Indications and important safety information. Indications. SAJAZIR, icatibant injection, is indicated for the treatment of acute attacks of hereditary angioedema, HAE, in adults 18 years of age and older. Important safety information. Warnings and precautions. Laryngeal attacks. Given the potential for airway obstruction during acute laryngeal HAE attacks, patients should be advised to seek medical attention in an appropriate healthcare facility immediately, in addition to treatment with SAJAZIR. Adverse reactions. The most commonly reported adverse reactions were injection site reactions, which occurred in almost all patients, 97%, in clinical trials. Other common adverse reactions occurring in greater than 1% of patients included pyrexia, 4%, transaminase increase, 4%, dizziness, 3%, and rash. Post-marketing experience. The following adverse reactions have been identified during post-approval use of icatibant: urticaria. Drug interactions, ACE inhibitors. Icatibant is a bradykinin B2 receptor antagonist, and thereby has the potential to have a pharmacodynamic interaction with ACE inhibitors, where icatibant may attenuate the antihypertensive effect of ACE inhibitors. Clinical trials to date have excluded subjects taking ACE inhibitors. Use in specific populations, pregnancy. Available data from published literature and the pharmacovigilance database with icatibant use in pregnant women have not identified a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for icatibant and any potential adverse effects on the breastfed child from icatibant or from the underlying maternal condition. Pediatric use. Safety and effectiveness in pediatric patients below the age of 18 years have not been established. Geriatric use. Elderly patients are likely to have increased systemic exposure to icatibant injection compared to younger, 18 to 45 years, patients. No dose adjustment is recommended. For more detailed information, please refer to the full prescribing information at sajazir.com/pi. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-800-836-4380 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.